I know from personal experience it can be tough to transition from a student nurse to a professional nurse. I remember when I started my first job in the emergency room, and I sat there twiddling my thumbs because I still had not successfully gotten an IV in and I was about to hit the ground running. Little did I know that there was such a thing as nurse residencies. And that's why I'm excited to tell you about HCA Healthcare's nurse residency program. This program supports newly graduating nursing students at the early stages of their careers. HCA Healthcare's year-long nurse residency program helps first-year nurses transition from the classroom to working in the field with confidence. Plus, nursing residents get access to a range of opportunities to learn from specialists in various areas, such as ER, critical care ICU, and surgical services. And there's a variety of other great benefits. Learn more today at careers.hcahealthcare.com/residency. Again, that's careers.hcahealthcare.com/residency. HCA Healthcare is an equal opportunity employer.
Welcome to the Nurse Leader Network podcast with your host, Chris Racinos. Wherever you're going on your nurse leader journey, we're here to help you get there.
Welcome, everybody, to another episode of the Nurse Leader Network podcast. Today, we have somebody who has done it all. We're going to be talking today to Beth Haney, who is the mayor of Yorba Linda, the past president of the California Association of Nurse Practitioners, and owner of Lux Aesthetic Center. Welcome, Mayor Haney.
Hi, thank you for having me.
Oh my gosh, I'm so glad that got you on. For everybody that's listening, today is officially Florence Nightingale's 200th birthday. That's right, it is May 12th. And what better time than to sit down and talk about all things nursing, all things politics, all things COVID. So, Mayor Haney, talk to me a little bit about how did you go from nurse practitioner to mayor? To me, those are like the two opposite ends of, the spectrum.
Yeah, really. I know, politician, right? So I was, like you just mentioned, I was president of the California Association for Nurse Practitioners, and I was on that board for about 10 years. And, my terms were all, coming to an end. So my commitment, I was going to about roll off of that board as immediate past president. And at the same time, I noticed that 3 city council seats were up for election, and there were 2 incumbents running and 1 open seat. And I thought, well, gosh, I'm just off the board of this big organization. We have 22 chapters in California, and it was a lot of policy, and I had a lot of contacts in Sacramento and knew how a large organization ran. And I thought, well, a city must be very similar. So I figured I had some good experience. And so I threw my hat in the ring and filed papers in August of 2016, and then campaigned almost 24/7 until November, I think it was 4th, that in 2016, and ended up winning. I ended up accidentally unseating an incumbent.
Oh, wow.
Yeah. So, and they determine that through like the number of votes that you get. And so, but it was interesting because I have an aesthetic practice as well in Yorba Linda, and I've had that practice for 14 years. I've got 9 employees, 3 nurse practitioners, 1 RN, and a couple of estheticians, and we are, really successful there. And so we've been advertising, with our pictures in the magazines, and we've been advertising for 14 years. So I think that the business itself helped, with name recognition and face recognition in my city. And then about a year and a half ago, a resident came up to me and she said, gosh, I didn't know you at all when I voted for you. I had no idea what you stood for, but I saw on your ballot designation that you were a nurse. And she's all, and that's all it took. I knew I was going to. So, because nurses, we are the number one trusted profession in the country for, I believe it's 8 years straight or 18 years straight now. And so, yeah, that's why it's funny for when you said a mayor is kind of the opposite of a nurse practitioner. It kind of is, but I think more nurses should run for office.
So let's bring it way back to the time that you served on CANP. How do you get to do that? So if there's a nurse out there that's like, that sounds kind of interesting. Like, where do they even go to even begin that journey?
Oh, that's an easy one. So you join your organization, first of all, your professional organization. And for me, it was the California Association for Nurse Practitioners because I was a nurse practitioner, but they also have the American Nurses Association. They have the American Emergency Nurses Association. So there's multiple nursing organizations that you can join, but your state organization is the one who's going to represent you in your state with your specific policies. So that's the one you would join first, get to know people, go to the conference, learn about the organization, and then run for local, if they have chapters, then run for your, board seat on your chapter. And then maybe you'll become president of that chapter. And then maybe you'll become a committee member on the state organization level. And then you work your way up from there.
How did you, aside from having the experience with CANP, how did you learn the steps that it took in terms of like campaigning, and were you able to raise funds, or, talk to me about that?
Yeah. So if there is a nurse out there who is thinking about running for office, I would love to talk to you and encourage you to do it. It does take a lot of work. And like I say, for me, I kind of had a head start because of my business. So what's very important is name recognition. So if you're known in your community and you have, if you're working in a private practice or in your local hospital and you have a lot of people that live in your city that know you, that'll be helpful. Otherwise, it takes about a year and a half typically to run a successful campaign. And what you're doing is, like, for me, my journey was very short. It was only 3 months, but I crammed it all into 3 months. And basically what you do is you should look at hiring a campaign manager, and that costs money. But the campaign manager, you'll want to vet them first, make sure that they're legitimate. And they help you with your mailers or your yard signs or the zip codes that you need to focus on, or the addresses in your city that you need to focus on, because they have all this information on which address voted, how many times in the last 5 elections. Because if they aren't voting, you don't want to waste your time campaigning to that person. They're probably not going to vote this election either. So, there's those little secrets like that campaign managers have. So I would recommend a campaign manager, but the issue is they can be expensive, several $1,000s, depending on your city. I mean, San Francisco and Newport Beach are going to be extremely expensive to run for office. Whereas in Yorba Linda, we're a small city. We're just under 69,000. And it cost about $35,000 in 2016 to run, but this year it's probably going to be around 50,000. That's a small city. Something like Newport Beach costs about $250,000 to run for a council seat. And so fundraising is super important. So you want to fundraise. That's another thing that's very difficult for nurses, nurse practitioners to do, is ask for money. That's very difficult. So you have to kind of get over that and realize that you're asking for money so that you can become elected, so that you can make a difference in your community, so that you can work for your community. And the reason that you need to raise money is because those mailers, that junk mail that you get, that all costs money, but it's all very effective. Even though you think, oh, it's just junk mail, someone's going to look at it for 2 seconds and then toss it. But in that 2 seconds, they're going to get an imprint of you and what you stand for. And if you say, that you're a nurse or a nurse practitioner, they tend to read it a little bit more in depth. But so those cost a lot of money. It was about $10,000 every mailer, every round of mailings, which we did 3 altogether. And then the yard signs, those signs that you see up and down your city streets during election year, those Those are expensive. They can be up to $3 a piece. And so that's expensive. And when I met with my campaign manager, I was like, okay, I do not want to have those yard signs. They're awful. They're like littering, it's like all you see is this litter all up and down your streets. You've got 10 or 12 different signs of different people's names, like shoved in this corner. It's like, it just looks so terrible and it's ridiculous. And he was like, no, they really work. And so sure enough, what I learned since I became elected, but what I learned was that people perceive those yard signs as the more you have, the more popular you are and the more successful you are. Isn't that interesting? I thought that was weird.
That's really interesting, but I can see it. Like when, if you have your face anywhere, like even if it's like, I guess even the back of like a milk carton, I don't know, but
Yep.
you're right. It's just kind of that face recognition. And when we get those pictures of people, we as humans, like we look at people and we see trust and we begin to identify trust versus just a name that you've never seen a picture of.
Right. Yep. And so the mailers were used with pictures and names, but the yard signs are typically just, you'll see the last name big because we want people to see the name. And so when it comes time to vote, you'll see that name on the ballot and go, gosh, I think
I know that name.
Person? Yeah, I recognize that. I'm going to vote for that one.
Wow. What did you have to do in terms of your mindset to shift it to going into like, okay, I'm fundraising for a really good reason. It's to help other people. Like, what did it take?
Well, I'm still getting used to that. It's still hard. It really is. But now it's like I've been doing a lot of good work for the city, so it's easier, definitely. But still, it's I don't know of one. Well, actually, I do know of a couple of people that love asking for money, but I don't know very many people that want to ask for money. But now, I'm realizing with all this work that I've been doing, I can kind of reflect back and look at that and go, yeah, that's why I need money to get reelected so I can continue this good work.
Yeah, it's great. I actually know of 4 people that always ask for money. They're my children, so they might be good. They might be able to help out.
Oh, absolutely. They'd be great people to have on your campaign for sure.
Oh my gosh, I love that. So like, okay, this is like maybe off topic, but like, are you have any plans to write a how-to guide or a book or something like that so that you could kind of like infuse in the nursing profession? Like number one, it's your public duty, right? Like we're the most trusted profession. It's our duty. But number 2, like here is a step-by-step guide for you to do it. Like I can see you doing that and then, becoming the president of the United States. Just
that is a great idea. That really is. I have not written a book on that, but yeah, that's a really good idea. I could do like a guidebook, but what I have done is made this type of presentation, on how to run for office at the national conferences. So my PowerPoints are out there somewhere, but the state conference, for CANP, and then so the American Association for Nurse Practitioners or of Nurse Practitioners, I've done the talks on how to get elected a couple of times each. So, making a little guidebook would probably be pretty easy. I've got the foundation for that.
Yeah. Or not, like even if you wanted to go more in depth, I could see it being really part of a nursing curriculum, right? I mean, that we are the largest health profession. We don't use our voice because it's not united enough. And so giving nurses these skills and being able to put them in positions where they can really impact, on huge local and state and national levels, I just think it's a great idea. So I'll be the first one to buy your book. I want to autograph though.
Okay, I will let you know when that happens. That's a good idea because I believe, in my heart and soul that more nurses should run for office, political office. They, first of all, we have critical thinking skills. We base our decisions on evidence. We are compassionate. We care about others. We want to take care of people, not just individuals, but oh my gosh, families and populations. And who better really, and I've said this numerous times, but who better than a nurse or a nurse practitioner to run for office and lead a a city or a state or the government, the federal government. It's like, I think that we're so valuable. And we mostly have, I think, I hardly ever use the words always and never, but I want to say we always have other people's best interests in mind.
Yeah, I would totally agree with that. And could you imagine what the United States would be if all of our politicians had that on their mind?
Right. Yes. It would be a great world.
Oh man, I love it. So, okay, you're a mayor, you're a nurse practitioner. We're in the year of the nurse, and we are smack dead in the middle of a pandemic. What are your thoughts around that?
That is the craziest situation. So to be mayor of a city during a global pandemic I feel like I'm lucky. I'm very, very grateful that I am the mayor because again, people trust what I say. I say nothing unless it's straight from the CDC or the latest evidence. And it's wonderful because I already have an understanding of immunology. I'm not an immunologist, but I have a nursing and science and medical background. And so none of my other council member colleagues have that. And as a matter of fact, I'm the only nurse practitioner in Orange County that's a mayor, and then one of two in California. So I feel very fortunate to be the mayor at this point because I'm able to lead the city and come up with things that make, that are pretty common knowledge for nurses and NPs, but maybe city government doesn't even realize that, hey, you know what? Like, for example, a couple of days ago, I asked for the city to create a document to post on our website on the COVID page, the COVID-19 page, on vulnerable populations because people don't really know that. All they hear is stay at home and old people need to stay home. That's what they say. Those aren't my words, but they're just telling the older people to stay home. And it's like, well, wait a minute. It's not just that. So here's a few more people that really should stay home, and just things like that. Simple language so that the public can understand it. Because we're as nurses, we're used to working with families who care for young kids, who care for their maybe aging parents or their grandparents. So it's things like that I'm very grateful that I'm able to come up with those ideas and have them run with them and put them on our website.
Yeah, I think the city of Yorba Linda is especially lucky to have you during this time because it just the worldview in which you bring solutions to that community, it's priceless, right? I mean, so I just first of all, I just want to say thank you because I think the work that you're doing is a lot of times probably really thankless, but it's so meaningful. And so, what kind of work have you done since you've been in the role? It's been since 2016 for the city, or who do you work with in terms of local or state or national folks?
So we run closely with our county officials. And so the Board of Supervisors, we've done work together, especially now, with our the guidelines that are being formed by the governor and how to implement them. And because I'm a nurse practitioner, they put me on to an ad hoc committee for the testing, the COVID testing in the community, because in Orange County, where I live, we have 34 cities. And so that is so similar to running the California Association for Nurse Practitioners, which had 22 chapters. Now I'm dealing with 34 cities, all which have mayors. And so bringing them together to work together and get Orange County healthy has been quite a challenge, but it's very interesting and very familiar to me. So, but I've also been on calls with the Orange County mayors every week, then the United States Mayors Conference, that's what it's called. It's all the United States mayors. That's a call every week. And then the White House puts on a call that I attend. There's the Health and Human Services. There's the Transportation Department, the Labor Department, Department of Justice, the Department of Defense. I mean, they're all on these calls. So it's very interesting. And I've learned a lot from a lot of these people. And one mayor that I learned from, Mike Duggan, he was great because he's the mayor of Detroit, and he lost half of his police force in his city. So if you can imagine losing half your police force, to COVID-19, because what he said happened was everyone was so concerned about the nurses and the firefighters and the physicians. We have to get them their PPE, and we have to make sure that they have their masks and their gloves and they know what they're doing and all this stuff. And it's like, but they all forgot about of law enforcement. And because if you think though, nurses and physicians, we've been washing our hands and wearing masks and, using PPE correctly since we were all born.
Yeah.
So we didn't need that help, but as far as like learning how to use it, but the police force needed that help, and they didn't have it. They were going into homes, they were, pulling people over, they were becoming exposed in all kinds of ways. And so he lost half of his police force. And so I took that back to my city, spoke with my chief and said, you guys, and this was weeks and weeks ago. And I said, you guys, we need to make sure that you're trained. And so then he took it to the county, because we are the Orange County sheriffs. And then they've implemented a plan. Turns out they were working on it about a month before I brought that up. But in our city, they were lagging just a little bit. So I'm glad that I was able to reinforce that. But it's things like that I've learned by working with other officials in different levels of government. So it's been really good.
What is one of the most like shocking things that you've learned since you started, or something that you were just like, whoa, I didn't realize that's how that was?
You mean as far as in politics in general, or?
Yeah, in politics or in the way like cities run.
Gosh, there's a few, something that's shocking, like newsworthy shocking. I don't
know about like maybe not tabloid shocking, but something that as a nurse, like we wouldn't even like have, something that maybe you wouldn't have even thought about as a nurse in terms of like the way our cities run, or the way, I have no idea. I'm just kind of like trying to think, like as a politician, I'm sure you see like some really interesting things.
Oh yes. So there's because now you have to be politically correct, right?
I know, right?
So there are so when you make a decision, no matter what decision you make, whether it is pure 100% evidence-based policy decision, no way that anyone in the world could refute you made this decision, it just is completely vetted. So your decision and the outcome is exactly, what it should be. And no matter what, you're going to get people that write to you and say the exact opposite, that you made a big mistake. That's something that's interesting, because you can't, like for us, for nurses, we're taught science, and you can refute some science, but really if it's data driven, you can't, it's kind of like,
right.
Whereas if you have, like a health policy or a general policy decision made, you can refute that all day long. So that's kind of that was an interesting thing. So you basically make half the people happy and half the people unhappy with every decision you make.
That sounds like my everyday life.
Yeah.
Oh man. How are you communicating with the community? I know in New Zealand, their rep there has just been doing things like Facebook Lives and just things that you don't traditionally see a leader, a political leader do in terms of getting the information out to their people. What kind of ways are you communicating with the folks of Yorba Linda?
Right. That is exactly right. As far as like new ways to communicate. So with the city, so they've never really done like public service announcements. And so this time, during this crisis, we actually did a public service announcement that is on our website, but they also, flooded their Twitter and Facebook and Instagram account with the PSA. And so that's one way. And then I've done a few webinars now. One was with the Small Business Development Center, and that's a national organization, but they have county chapters. And so we worked with one of my other council colleagues, Carlos Rodriguez, and Small Business Development Center, and did a webinar, which was fantastic. Oh, and Assemblymember Philip Chen was also involved. And it was fantastic because I brought the local level info, and then Assemblymember Chen brought the state level, and then the Business Development Center provided all this super helpful and free business advice. And they gave, a lot of links to like PowerPoints that business owners could look at, or books that they could download. I mean, it was really good. And then so I have a personal Twitter account that I put out some information, not as much as my mayor's Facebook page. That one, I'm almost every day giving updates. Some are video updates because, like we were talking about, we have to think of new ways, because people don't want to just keep looking at document after document or text after text. They want some kind of video presence. And so I've been doing a lot of those. And
that's awesome.
That's about it.
Have you got on TikTok yet?
That's funny.
I know it's funny, but it like really appeals to millennials. Like I it's so funny because I opened an account for this for the Nurse Leader Network, and like at first I was like, oh, it's my daughter uses it, right? So I was like, oh, it's a teenage thing, and then I started seeing the videos, and I was like hooked. I was like, oh my God. My husband's like, can you get out of the bathroom off TikTok? And I'm just like literally in there just so I can watch TikTok alone without the kids bothering me. And it's so funny. And there's like all kinds of videos about like how the pandemic has forced all of the millennials to like join in, and we've taken over TikTok, and now all the teenagers are mad about it, and it just is what it is.
Oh my gosh, that's hilarious. That's so funny. Yeah. And my husband discovered it long before I did. And he's like, I got to show you this video. I have to show you. What? And some of those people are so talented.
Oh, I know. The things that I see, I'm just like, it's like better than Hollywood.
Oh, totally. Very entertaining.
You mentioned the small business webinar. Did they record it, or is there a link that I could put in the show notes to share with folks so they can look if they have a small business?
Oh, sure.
Okay, great. So I'll include that in the show notes. And then the next question I was going to ask is, I can imagine, I'm a nurse executive. And so I know, when all of this happened, I think I think the total amount of days that I worked straight was something like 48 or 40 or something like that. And, like some of the days are like 18-hour days or like no less than 10-hour days. And so I can imagine as a mayor, when you're just trying to get everything in place, that the hours are long. Can you share with us maybe like what were some of your strategies for keeping well? What did you do to make sure that you stayed in a good place going through all of this?
Oh my gosh. Yeah. So, the city has gone remote. So now we do our council meetings via Zoom. And then, so City Hall is closed to the public. We only have a few staff at City Hall. And then with my business, we closed the business, except for now we're doing just several hours, 3 days a week, retail where you can call, pay for it, and then we hand it to you, outside or what have you. And then, just getting enough sleep for sure. And I'm living by my clock. I tell you, I have meeting after meeting, it seems like phone call after phone call. I've been doing lots of interviews, especially now because my nursing colleagues have been reaching out for the past week because it's Nurses Week. And then I also make time. This is going to sound crazy, but I try and schedule a nap almost every day.
Oh, wow. That doesn't mess with your sleep at night?
No. See, I'm one of those people that I could probably, as I look down on the floor right now, I could probably lay there and fall asleep. I have no problem sleeping. And so,
I think mine is like I would take a nap and then I would wake up the next day.
Yeah. Well, what's so funny is I have to set the alarm. Otherwise, I could sleep. that really helps me. And then exercise, I exercise regularly, go out for a run. I have to, and I think it's important for all nurses, anyone really, is to, you've got to make time for yourself. If you're constantly caring for others and getting inundated with demands from others, it's like that really wears on you, even though you can do it. And we, us nurses, we're tough for sure. But it starts adding up, and I think we really do need to do a better job of taking care of ourselves.
Yeah, I agree. And to all the listeners that are on the line right now, if the mayor can make time to exercise and sleep, you need to figure out how to make time to exercise and sleep.
Yes, I agree.
So what are your plans? You said that you're working on the reelection. What do you have, like a kind of path in terms of where you want to land, or what your next gig might be?
So that's a really common question, and city council has been used historically as a stepping stone to go for a supervisor seat or a state position or others. The employment development department, all kinds of other positions. But what's so nice is that working at the city level, these are my people. This is my neighborhood. This is my community. And so I know so many people, and I love my city, and Yorba Linda is it's so beautiful. And I don't want to leave. I don't want to live in Sacramento, 9 months out of the year to be an assembly member or a senator. And I don't want to live in Washington, D.C. to be a congresswoman. My heart is in Yorba Linda. And I mean, who knows what the future is going to hold, but I'll tell you what, it costs millions of dollars to run for a higher office. And you are doing a lot of campaigning. So I'd rather do more good work at a local level and watch what happens. You can see what happens when you approve a new public library, for example, to be built. I'm watching our new public library being built right now, and so it's really gratifying. It's wonderful to work at the city level. I love it. So
that's really great insight, and I agree with you. It's really nice to be able to see, like, where you live, work, shop, grow. Your family member, like, just kind of see the impact you have on, like, your people, like where you grew up.
Yep. Yes, for sure.
How is the community handling the shelter in place? Today it was just announced that it's likely to be extended through July.
So that was not California, I don't believe. I think that was LA County.
Oh, yeah. You're right. It was LA County.
So, yeah, the LA mayor decided that he wants to extend the shelter in place for another 3 months or something. And people are going crazy over here. So our Orange County has no plans of doing anything even remotely close to that. We are sticking with the state guidelines, which right now they're working. Our numbers are great. Orange County has great numbers right now. But as soon as the governor is starting to loosen restrictions, Orange County is also going to be loosening restrictions. And so the city, like I may have mentioned before, is bound to the county, which is bound to the state. So we can't move any more. We can't move in advance of anything that the governor says or that the county guidelines provide. So, but we can become more strict. Like, in other words, one of the cities in Orange County has mandated that everybody in any store wear masks. They passed that ordinance in their city, which the state has not mandated that. So they're going more restrictive, whereas Yorba Linda has not. We have not instilled anything more strict than what the governor's guidelines are.
Okay. Yeah, in Los Angeles, I live in Los Angeles, and we're wearing masks. Now it's to the point where my 2-year-old, like, even in the house, she wants to keep her mask on. She thinks it's like this wonderful thing. I know it's kind of cute, and at the same time, I'm like, oh, poor baby doesn't understand.
Yeah, and so we have to be careful with older people and people that have lung compromises or the people that are under 2 years old, they shouldn't really be wearing masks. It's like, because they're rebreathing that carbon dioxide. So it's like, oh my gosh, it's there's science on both sides, really.
Yeah, it's true. It's really true. So, what would you tell a nurse, for those nurse leaders that we have on here, to take as a first action step? They've heard a bunch of information around politics, around your own organization, around the impact they could have. What is the one thing that a nurse could do today to start their journey into policymaking?
So policymaking, you can join your state organization. That's number one. If you wanted to go into elected office, you'd want to first and foremost figure out why you want to do it, and then that is going to be your message. And you want to be very clear and concise with your message, because that's what's going to resonate with people. And so that's the very first thing. And the second is ask your family if that is something they would be able to support you in. Because your family is who's going to be helping you. They, like my husband, he is the one he worked right alongside me 24/7 to get my campaign to make it successful. And then just start doing the steps, start looking around, doing your research, go to your city website, check it out, see who's in office now. See how they compare to you. See what skills you have to bring to the office. That's where I would start, definitely. And then you could hire your campaign manager, and go from there. Talk to your friends. What I did too, I forgot to mention, was when I was thinking about running, I actually made appointments with the city council members and the mayor one at a time, and kind of just talk to them, see what they were doing and what they thought of it, if they liked working at the city, and just kind of start getting out there.
Those are great tips. When you said they should think about their why, or why they want to get into it, are there any things that come top of mind that are like red flags? Like if you had a why that was ABCD things, that would be a red flag that maybe you shouldn't be running for office.
Oh, the big red flag is, especially at the city level, don't do it for the money. None. That is a big red flag. As a matter of fact, some city council members and mayors are volunteers. They do not get paid anything. And so you'll definitely want to find that out, but if you're doing it for the money, don't do it. Same with nursing. If you're doing nursing for the money, forget it. Don't do it. You're not going to be good at it.
Yeah, I agree. I've met many nurses that went into it to fund their life while they did what they actually wanted to do. And it was just, not always the best situation. So
exactly.
Totally agree.
Mm-hmm.
Well, listen, Mayor Haney, if folks want to find out more about you, or find out more about, your either one of your business or your policy work, where can they find you?
Oh, they can. So on Facebook, I think I think you have those links, those things,
Yep.
But you can also email me anytime at bhaney@yourbelindaca.gov. And I get every email, I get them all. And I have an assistant that helps, but, if I see any from any nurse colleagues, I will definitely answer back.
Awesome. Thank you so much. And happy Nurses Week to all of you amazing nurses. Thanks, Mayor Haney.
Thank you so much. It was great.